Hi everyone, and welcome to this afternoon's lesson on biological treatments for OCD. So I've recorded you this as a video lesson just because some of the concepts I know some of you will find obviously tricky because you're not overly fond of the biological approach. So what I suggest that you do this afternoon, even though I'm not there, is maybe do this work in pairs or in your little groups, and obviously do all your whiteboard activities as you normally would, because they are going to really help you with this stuff, kind of process the information. So don't just kind of skip through this video looking for the bits to fill in your booklet. Take your time with it, get into small groups, get into pairs, and actually just do the activities with me as we're doing it, kind of on your whiteboards like you would do if I was there. So if you want to help yourself to a whiteboard now, just kind of get yourself sorted. Booklets out but not open as we typically would do. And I am just going to precursor this just by saying if you hear a little scream in the background, it's because the baby monitor is playing, okay? So I might have to pause it. So yeah, so get yourself sorted and we'll get going. So we're going to work our way through these biological treatments for OCD in quite a slow fashion, all right, but quite a logical fashion, I hope, or I think. And the first thing that we need to do is we need to start at like the key assumptions point. So what do we already know about OCD and the causes of it to therefore propose an effective treatment, okay? So why might antidepressants be used to treat OCD as well as just somebody who is depressed? So on your whiteboard, just have a go at filling in what you think would go into those blanks. So pause this here. What are we popping in there? Come back as soon as you've done it. Okay, so what we had previously learned from the reading last week and when I saw you on Wednesday is that OCD may be caused by low levels of serotonin, and thus we're assuming that drugs which increase the activity of that neurotransmitter serotonin may well therefore help alleviate the symptoms of the OCD. Okay, and this is in a nutshell what antidepressants do. Okay. I did forget to add that there's a crazy dog running around in the background as well. Apologies. Okay, so that's our starting point for this afternoon's lesson, that an antidepressant drug works on the proposal that OCD in some way is related to low levels of serotonin. So we want to therefore increase the level of serotonin. So the next thing that we have to understand is how are we actually going to go about doing that? Now, for you to understand how an antidepressant drug works, you need to firstly understand a little bit about normal synaptic transmission. So again, I'm going to put something up onto the screen now, and I want you to kind of reproduce this initially just onto your boards. It doesn't have to be perfect. This is just a preemptive question to see how much you know about synapses and synaptic transmission to begin with before I go any further. So pause this, draw that onto your diagram, and then you can see he's asking you to try and annotate it already. So just give that a whirl. All right, spend maybe a minute or so. I think my other class like literally took a minute and they couldn't go any further. But do you know any of those labels? Pause this now. See how you get on with that. Okay. I'm going to pop up now some helps or some kind of tips. Does that give you any more of the answers there? Do you need to change? Okay. So, to begin with, like I've said, you've got to understand the process of normal, in inverted commas, synaptic transmission, okay, before we can start looking at how the drugs work. So, I'm going to go through, all right, and you can tick off the answers that you got correct. So, we'll start over here in the top right hand corner and kind of work our way down, okay. So, in the top right hand corner, this would be the presynaptic neuron, okay. So the presynaptic neuron is the neuron which is activated via an electrical impulse, okay? So the presynaptic neuron, all right? So before synapse, okay? So presynaptic. synapse. So this is what receives the electrical impulse. This is what will fire the neuron essentially. So the presynaptic junction or the presynaptic neuron. Now, embedded within the presynaptic nerve ending or neuron, you have got several, okay, it's difficult to estimate how many, hundreds, thousands of these vesicles. Now, a vesicle is just a word for a chamber, essentially, or a sac, if you will, okay? So within those vesicles, like I say, there are lots and lots of them contained within the presynaptic neuron. Within these vesicles, we actually have the neurotransmitters. So there are specific vesicles containing specific neurotransmitters. Obviously, the one that we're concerned with this morning is serotonin, okay? So presynaptic neuron is activated via an electrical impulse. The vesicles then will be triggered to release the neurotransmitter. The neurotransmitter then actually crosses the synapse. Now, there is a specific term or phrase that we would use for this kind of gap, and it's known as the synaptic cleft. The synapse is the thing as a whole. This little gap here is known as the synaptic cleft. So when the presynaptic nerve ending is activated, the vesicle will release the neurotransmitter across the synaptic cleft. Now, once it crosses the cleft, it will be picked up or it will bind to, which is the correct terminology, receptor sites on the postsynaptic nerve ending or membrane, okay? So it crosses the synapse and then it's picked up, absorbed by receptor sites, okay, which bind to those receptors on the postsynaptic neuron. Now, anything that is left over within the synaptic cleft is retaken away by the presynaptic nerve ending. Now, this process is called reuptake. So anything that's left over, all right, within the synapse, okay, is reabsorbed. Like I said, the process is called reuptake. It's reabsorbed by the presynaptic nerve ending, and it will be attacked by enzymes. It will break that neurotransmitter down so that that person can reuse it for later neurotransmission. Now, in order to understand how the drug works, you've got to have a bit of a basic understanding in terms of that normal synaptic transmission. So have you been paying attention there? Grab your whiteboards again, wipe any diagram off just to begin with. All right, I've just taken you through the process. It's very, very basic level. So now just tell me, what do you think goes into those spaces? Have a quick go. Pause me here. Are you going to get them right? Okay. So let's go through the right answers then. We'll see if you've been paying attention, see if we've got these right. So when neurotransmitters cross the synapse or the cleft, they bind to and are absorbed by receptor sites on the postsynaptic neuron. The remaining neurotransmitters are then reabsorbed or go through reuptake by the presynaptic neuron, where they are broken down and reused. So hopefully you are able to fill in those quick 4 spaces for me now, okay? Right, let's take it one step further, shall we? I'm now going to ask you to just redraw that diagram in very, very basic terms, all right? And as you're doing that, I want you to carefully consider what the problem is in an OCD brain, okay? What the issue is with this particular disorder. And if we remember from the previous slide, it's because they have low levels of serotonin. So in their brain, and in somebody who's depressed, we want to elevate the level of serotonin. So my question to you here is, and you need to pause it whilst you're having to think about it, where do you think this drug is going to bind to? All right. Where is it going to sit at a synaptic level which would serve to increase the level of serotonin that that person is receiving in their brain? So draw it on to your synapse, okay? Pause this here, have a quick chat about it. Where do you think it's sitting? Is it going on the presynaptic membrane? If it is, where do you think it's going? Is it going on the postsynaptic membrane? If it is, where's it going? Or do you think it's going into the synapse? Where do you think this is actually going to bind to? So chat about it, pause this video here, please, all right? And we'll see if you get it in the right space. Okay, so hopefully you have put this in the right place, okay? Most people do, but we always get a couple that get it in the wrong area. So in order to increase the level of serotonin in a OCD patient's brain, the antidepressant must sit here. Okay, so I hope my cursor's coming up there, but I'll explain what I'm pointing to. It's going to bind to the presynaptic membrane, okay? It will block the vesicle entry, okay, or pathway, and it will act almost like a sheath, all right? It will wrap around the presynaptic membrane. It's only got a very, very short half-life, so that won't be there for a very long period of time. The longer it's there, the more kind of side effects are created, but it binds to the presynaptic membrane. And what happens as a result of that, excuse me, is that the neurotransmitter has to stay in the synaptic cleft for a longer period of time. We think in somebody who is depressed or who has got OCD, either reuptake is happening too quickly or too much of it is being removed from the synapse. So by binding to the presynaptic membrane, more of it stays in the synapse for longer, more of it therefore is absorbed by the receptor sites on the postsynaptic membrane. Okay, so hopefully you got that right. So let's wipe our whiteboards down. Let's continue moving forward. We're now going to actually take a look at one specific example of a drug used to treat OCD and also depression. And this category of drug is known as a tricyclic. Okay, just bear with me 2 seconds. Okay. So our first category of antidepressant drug then is the oldest type of antidepressant that can be prescribed to an individual. It's also less commonly prescribed nowadays, okay, and they are called tricyclics. A specific example of a tricyclic would be clomipramine. You might also see these drugs referred to as an SRI, okay, so these are tricyclics. Now, what they do in the brain is they obviously seek to increase levels of serotonin, but these drugs, tricyclics, also increase noradrenaline, okay? Now, we're going to see if we can figure out, based on what I have already told you, how you think this drug works, all right? So hopefully you're paying attention and keeping on board with this. So I would like you to now use the diagram to help you, but again, pause this here and see if you can tell me what you think is going to go into these blanks. In someone who is taking tricyclics with OCD, how is this drug going to work? Have a go, pause it now, all right, and see how you get on with the blanks. Okay, so how did we get on with this first challenge then? All right, just this little gap fill here based on what I've already told you, okay? So a tricyclic will prevent reuptake or reabsorption of serotonin and noradrenaline. This prolongs the time serotonin and noradrenaline are in the cleft or the synaptic cleft. Tricyclics bind to sites on the presynaptic neuron. It allows more time to bind to receptors, therefore, on the postsynaptic neuron. And this will increase the activity of the neurotransmitters generally. So tick all of that off if you got it right. Well done. If you have on this first occasion got the description of tricyclics correct. So wipe those down. Once you're happy with that, let's move it forward. Now, the second class of antidepressant drug is known as an SSRI, and this stands for Selective Serotonin Reuptake Inhibitors. So you might be able to tell from its title that these drugs only act on serotonin. That's why they're called selective serotonin. An example you may well have heard of is Prozac, or to give it its chemical name, fluoxetine. And they work in the exact same way as a tricyclic, except for they only work on serotonin. So now let's make it a little bit harder. Grab your boards again. Can you reproduce that gap fill that we had a few moments ago? Don't cheat, don't rewind it. Just pause this here and see how much of that you can get written down into a little paragraph. Off you go. And before I reveal the answers, I will just give you this diagram. Do any of you need to use this now for the last minute or so, just to change your answer? And let's go through the correct responses. So again, using your whiteboards, tick off everything that you got right. So did you say the following? That an SSRI binds to sites on the presynaptic neuron? Tick it if you got it. Did you say, in doing so, they prevent reuptake or reabsorption of serotonin? Did you say, this therefore prolongs the time that serotonin is in the synapse? Did you say that that allows more time to bind to receptors on the postsynaptic neuron? And that therefore will increase the activity of serotonin. Give yourself like a mark out of 5 because there are 5 separate things that you need to say there. Well done if you got your 5 out of 5. Okay, so well done. You've learnt about the basic concepts of how an SSRI and a tricyclic works. All right. So we now need to go ahead and just get some bits and bobs into the booklets. So I don't have a page number here, all right? I'm afraid it's the one thing that I've not screenshotted, but hopefully you'll be able to find this in your booklets. I think it's like 41 or 42, something like that. So we want to go ahead now and just fill in the bit of key assumption. So the suggestion is that OCD is caused by low levels of the neurotransmitter serotonin. So by treating it with antidepressants, it will improve their mood and their kind of anxiety, so the thought control element of it, by elevating serotonin. And then you've just got a general bit of blurb, okay, about the 2 categories of antidepressants. So go ahead now with your highlighters, pause this, and just get couple of those little bits highlighted in your books. Okay, so the next thing that we need to move into is obviously getting in the description, excuse me, of how the drugs actually work down into our booklet. So this is page 44. So I've given you a word bank. Again, if you want to just pause this and try and see if you can figure out where they go. I will just clarify that the first 3 bullet points are just a general description of kind of synaptic transmission. So you might want to put a bracket around that. But then the thing that will get you the better marks in the exam is the bottom 2 bullet points. So you have to describe normal transmission, first 3, but then in order to pick up the top marks you have to then describe the chemical mechanism of the drug. So pause this here, see if you can get those into the right order, and then come back, we'll go through the right answers. Okay, so let's go through these then. Obviously you can tick them off if you want to, but I know that they're in your booklet, so just making sure that they're correct. Excuse that message there. So electrical impulses trigger the release of neurotransmitters from the presynaptic neuron. When neurotransmitters, i.e. serotonin, cross the synapse, they bind to receptor sites on the postsynaptic neuron. These neurotransmitters are then reabsorbed by the presynaptic neuron in a process called reuptake, where they are broken down and reused. Tricyclics and SSRIs work by binding to receptor sites on the presynaptic neuron, thus preventing the reuptake of serotonin and also noradrenaline for tricyclics. This increases the activity of serotonin neurotransmitters by prolonging their time in the synapse and allowing them to bind more to the receptors on the postsynaptic neuron. Well done if you've got all of that right now. So the next chunk in your booklet, all right, is this little space that asks you to explain exactly which symptoms would be treated regarding OCD. So if you think back to what we said the function of serotonin was, hopefully you'll be able to get to the correct symptom. Just have a quick chat about it in your groups or in your pairs. Can you think what that would be? So the symptom that is mainly treated with regards to OCD is the irrational thought processes, okay? Because if you elevate serotonin, you get that element of thought control given back to you. It will reduce the negative or irrational thoughts, and that therefore will reduce the anxiety as well, okay? So that's mainly the cognitive and the emotional symptoms that will be treated there. We do have one additional method of treatment that you need to be familiar with, and these are known as benzodiazepines, or to give it a broader umbrella term, anti-anxiety medications. So highlight the term benzodiazepine. Just going to pause this for a second and sort the delinquent dog out. Okay, so get used to how we spell benzodiazepines. Obviously, you know I'm all for the oracy and literacy this year, so trying to get that correctly included in your work. You can go shorthand if you desperately need to, so we can call them BZs. All right, so. You probably have heard of one of these benzodiazepines before, trade name Valium. Okay, so Valium can also be used to treat OCD and also kind of quite severe cases of depression, and they work by enhancing the action or the kind of chemical products of a neurotransmitter called GABA. Now, GABA, if you want to highlight it, is an inhibitory neurotransmitter. It's in actual fact, if you want to add this into your booklet, one of the most powerful inhibitory neurotransmitters that our brain produces. And it's the reason why it's so powerful is that it totally prevents neurons within the central nervous system from firing. For all intents and purposes, guys, if you want to add this into your book, benzodiazepines are tranquilizers. All right. So once GABA is elevated by taking this particular drug, once GABA is elevated, it will literally inhibit neuronal activity in your brain, okay, and in your body to a certain extent as well. So it really is slowing down that central nervous system. It is a tranquilizer, so it essentially does a calming job on your body, okay, and on your brains. By elevating GABA, everything is slowing down. So that will reduce the symptoms of OCD quite clearly, because they will no longer feel anxious because their brain is being slowed right down, so they no longer have the kind of intrusive persistent thoughts. But it also acts, this category of drug, if you want to add it into the little bubble, on the compulsion element. Because the central nervous system is being slowed down to such a degree that the patient, whoever's taking the drug, will feel quite sleepy, quite out of it, for want of a better phrase, then the compulsions will also not be as prevalent. So it's a very, very effective drug in real kind of extreme cases, I would say. All right. Valium is highly addictive and really dangerous in terms of its side effects. So it wouldn't be prescribed to anybody on a long-term basis. But if the OCD sufferer is experiencing a real heightened episode, then Valium will obviously, based on its mechanism, help them feel some sort of relief from that. All right. So that is all the descriptive material. What you have been provided with for this afternoon's lesson is an additional page which has got the 4 evaluation points on it. You now need to help yourself to scissors and glue, and you need to cut out these statements for me. All right. So pause this here, obviously, go ahead and get those chopped out and come back when you've got them available to you. So once you've got those chopped out, we need to get them popped into our booklets in the correct place. So the first evaluative point is obviously evidence to show that these drugs are effective. So if you read those back to yourself, there is only one of them that talks about the effectiveness, and it is Sumro. So Sumro was a meta-analysis which showed that in taking SSRIs, it was more effective than people taking nothing at all. In other words, taking a placebo drug. So go ahead and stick that in. The next evaluation point is to do with the amount of effort that is required with taking drugs, and it's plain and obvious that popping a pill is not going to require as much motivation as, for example, going through REBT or psychoanalysis, things like that. So it requires very little effort compared to some of the psychological therapies, and thus it has a positive effect on the NHS as well. Although when people stop taking drugs, they do relapse. So we've got a bit of a revolving door there. So some of you might want to add that in as a bit of an extension point. Over the page, we've got our criticisms. I cannot remember off the top of my head which way around they go. I think it's side effects first. So obviously you can see we've got a long list of side effects associated with these drugs, but do refer to the distinct side effects for each category because they are very, very different. And then lastly, we've got contradictory evidence, all right, and the fact that there is evidence in terms of relapse rates, which are quite significant. So hopefully you've been able to get those stuck down into your booklets. Okay, once they are stuck down into your booklets, you have now got 5 minutes, and it should just be a 5-minute block to read, highlight, and annotate those evaluation points back to yourself. What we're going to do here is a little exercise which hopefully demonstrates to you potentially one way that you can revise evaluation points. You are going to have 5 minutes, pure and simple reading time. It should be nice and quiet in the room when you are doing it. Hopefully you're all at a similar point and there's nothing else going on, no other distractions. Out of that reading time, I'm going to pluck some random words and random terms, okay? If you were revising, you could do that yourself. So you could be reading the evaluation points and just making a little list of just random words, numbers, facts, statements, etc., etc. When you've finished it, we're going to put the booklets away and I'm going to give you those random bits of information back and you're going to match them to the appropriate point. Once all of that is completed, it's then going to be back over to you to turn those bits of information into sentences. And as I said, this is a bit of food for thought for some of you who are struggling with evaluation of how you could potentially revise it. So off you go, pause here, give yourself 5 minutes solid reading time. Okay, so after your reading time, we now need to get a piece of lined paper available to you and divide it into the 4 sections that are listed on my page here. All right, and off we go now then. You match these to where you think they go. So 17. Hallucinations. Cheaper. Aggression. Placebo. $45. Compared to psychological therapy, and that goes in 2 separate spaces, so consider where they would go. Pause this maybe to write that in. 12%, 3 months, 12 weeks, and lastly, less effort. Okay, so let's just reveal the right answers. I have got one missing though, so you should have than psychological therapy somewhere else in there as well. Okay, and it's now just over to you. Last bit of the task is to turn any of those into sentences that you feel confident enough that you can repeat or regurgitate those sentences. So have a go. Once you think you've done them, open up your booklet again and double check the the wording of it, tick them off if you have got them right. Obviously, I'll be expecting to see this task, this activity on Wednesday when I see you next, okay? So that's everything that I wanted to do, and congratulations, you have now completed your first Year 13 topic area, which is psychopathology. Expect some testing on this material on Wednesday when I see you again. Obviously, 3 hours is a long time for you to be learning on your own, and we've had a few run-ins last year when I've had to be off due to the ill child again. Where people haven't done this work to a good standard. So please make sure it's all done to a good standard and that you're ready for some testing of that on Wednesday. Okay. See you all next week, guys. Bye.